I think I get job satisfaction because if someone looks comfortable and they look fresh, you know, they've had a shower, their hair looks nice, I get job satisfaction from making someone look nice, so that when their family see them, they're reminded of the person that they are rather than the patient on the bed, you know, trying to make them look more like that person, really. We always do that as soon as they come in. Our job is to try and remove the tubes as much as we can. You know, when they're really unwell, all the tubes go in, and our job is to try and get them out so they go back to looking more like the person they are. So, and of course, if someone appears to be in pain and you decide to make that decision to give them painkillers and then they look comfortable, then of course that's job satisfaction. And there are some people who make great recoveries, so that's always, we have our miracle patients, you know, some of them down the line, and we'll never forget them. So yeah, there's always job satisfaction. I always go home and think, yeah, today's been nice. And I work with a nice team of people as well. That always helps.
So you talked about the job satisfaction when people do make good recoveries and you can see they've got a quality of life that they value.
Mm-hmm.
What about when that doesn't happen?
Well, in that case, the job satisfaction would be, and it's a tricky one, isn't it? We have had patients who have had wheezing withdrawn more recently now, and their families feel that that's the right thing to do, and that's what they would have wanted. So to be a part of that, I suppose it is a job satisfaction in a different sort of way, because you're listening and you're facilitating that, and it's a difficult one, isn't it? But yeah, I think it's a privilege to be able to help. That's all. That's as far as I go, I suppose. Yeah, I wouldn't say you go home and feel happy with what you've done, but you can be a part of a good death and feel happy that in yourself that you've done the best job you can. I think it makes you be the best nurse you can as well when you're in these tricky decisions. It sort of makes you really want to do the best job you can. So